Atrial fibrillation is a condition where the upper chambers of the heart, called the atria, do not beat in a coordinated way with the lower chambers, known as the ventricles. This happens disturbance in the electrical signals that regulate the heartbeat. One common treatment for AFib is called pulmonary vein isolation. In this procedure, a thin, flexible tube known as a catheter is inserted into a blood vessel, usually in the leg or sometimes the neck. The catheter is carefully guided into the heart, specifically to the atria where the pulmonary veins connect. Through the catheter, tiny instruments are used. One helps guide the process, while another creates small circular lesions, controlled burns or wounds, around the openings of the pulmonary veins. This step is repeated for all 4 veins. Over time, these small wounds heal and form scar tissue. This scar tissue acts like a barrier, preventing abnormal electrical signals from the pulmonary veins from interfering with the heart's normal rhythm. Once healing is complete, the heart rhythm often returns to a more regular pattern.